Hey there, cat lovers! It's your old pal Playtime with Coco and Butters, and today we're talking about our feline companions. We love them to bits, but sometimes those furry little weirdos get themselves into trouble. So, we're diving deep into the world of 9 common cat illnesses and issues. From the weird stuff like Flute D to the oh no, they're throwing up again stuff. We'll help you decipher those cryptic cat symptoms. Because let's face it, a healthy cat is a happy cat, and a happy cat makes for a happy human. First up, we have feline lower urinary tract disease, or FLUTD. It's a serious condition that can cause your cat a lot of discomfort and even be life-threatening. FLUTD isn't one specific disease, but a bunch of different conditions that affect the lower urinary tract. We're talking bladder infections, urinary crystals, even blockages, which are super dangerous, especially for our male cat buddies. Signs include accidents outside the litter box, straining to pee, or crying out in pain. You might also notice blood in their urine, which is a big red flag. If you see any of these signs, call your vet ASAP. Early diagnosis and treatment are key. Your vet can figure out what's causing the problem and get your furry friend on the road to recovery. Next on the list is vomiting. Ah yes, the infamous hairball hack. While occasional vomiting is normal, frequent vomiting can be a sign of something more serious. Pay attention to the frequency, the amount, and the appearance of the vomit. If your cat is throwing up more than once a week, if there's blood in the vomit, or if it's accompanied by other symptoms like lethargy, loss of appetite, or diarrhea, it's time to call the vet. Vomiting can be caused by a whole host of things, from dietary indiscretion to infections, parasites, and even chronic diseases. It's always better to err on the side of caution and get your feline friend checked out. Speaking of things that can make your cat feel less than stellar, let's talk about those pesky little vampires. Fleas. Ah, fleas, the bane of every pet owner's existence. These tiny, blood-sucking parasites are the ultimate party crashers, setting up camp on your cat and making their life miserable. But fear not, fellow cat lovers, for knowledge is power. First things first, how can you tell if your cat has fleas? You might actually see them, especially if your cat has light-colored fur. They look like tiny, dark brown dots that jump. You can also look for flea dirt, which is basically flea poop. It looks like little black specks, and if you put it on a wet paper towel, it will turn reddish-brown. Another telltale sign is excessive scratching. Fleas are itchy, and your cat will let you know it. So what can you do about these pesky parasites? There are tons of effective flea treatments available. Talk to your vet about the best option for your cat. Whether it's a spot-on treatment, oral medication, or even a special shampoo, regular flea treatments are essential, even if you think your cat doesn't have fleas. Chapter 4. Tapeworms. These creepy crawlies are intestinal parasites that latch onto your cat's gut and steal their nutrients. The most common way cats get tapeworms is by ingesting fleas. If your cat accidentally swallows an infected flea while grooming, those larvae can hatch and set up shop in your cat's intestines. The most obvious sign is the presence of tapeworm segments in their poop. These segments look like little grains of rice or cucumber seeds. You might also notice your cat scooting their butt across the floor. The good news is that treating tapeworms is usually pretty straightforward. Your vet can prescribe an oral medication that will kill the adult tapeworms and their eggs. Prevention is key. Regular flea control is the best way to prevent tapeworms. Chapter 5. Diarrhea. Occasional diarrhea isn't usually a cause for panic, but if your cat has diarrhea for more than a day or two, or if it's accompanied by other symptoms like blood in the stool, vomiting, lethargy, loss of appetite, or fever, it's time to call the vet. Diarrhea can be a sign of a whole range of issues, from infections to parasites to inflammatory bowel disease. It can also lead to dehydration, which can be dangerous. Make sure they're staying hydrated. Your vet might recommend a bland diet for a few days, like boiled chicken and rice. Get your cat checked out by a vet to rule out any serious issues. Chapter 6. Eye problems. Cats have these amazing expressive eyes, but those peepers are also delicate and prone to a whole range of problems. Look for signs like squinting, excessive tearing, redness, discharge pouring at their eyes, or keeping their eyes closed more than usual. Eye infections are pretty common in cats, and they can be caused by viruses, bacteria, or even fungi. Conjunctivitis, or pink eye, is one of the most common eye infections in cats. Another common eye problem in cats is corneal ulcers, which are basically scratches on the surface of the eye. The good news is that most eye problems in cats are treatable, especially if caught early. Treatment might involve eye drops, ointments, or even surgery in some cases. Don't hesitate to contact your vet if you notice anything unusual about your cat's eyes. Early intervention can make all the difference. Chapter 7. Dental disease is more common in cats than you might think, and it can have serious consequences for their overall health. Cats are masters at hiding pain, so they might not show any obvious signs of dental problems until things are pretty bad. Bad breath is a big one. Other signs include drooling, difficulty eating or chewing, pawing at their mouth, red or swollen gums, brown tartar buildup on their teeth, and even changes in behavior. Plaque is a breeding ground for bacteria, and if it's not removed regularly, it can harden into tartar. Tartar buildup irritates the gums, causing inflammation called gingivitis. Over time, gingivitis can progress to periodontal disease, which is a serious infection that damages the tissues supporting the teeth. The good news is that dental disease is largely preventable. Brushing your cat's teeth regularly is the single most effective way to keep their mouth healthy. Start slowly, be patient, and use treats and positive reinforcement. You can also talk to your vet about dental-specific diets, treats, and water additives that can help reduce plaque and tartar buildup. Regular dental checkups are crucial. Your vet can spot problems early on and recommend professional cleanings when necessary. Don't neglect your cat's dental health. It's more important than you might think. Chapter 8. Over half of all cats in the United States are overweight or obese. Overweight cats are at increased risk for a whole range of health problems, including diabetes, arthritis, heart disease, respiratory problems, skin conditions, and even certain types of cancer. They might also have a shorter lifespan than their leaner counterparts. What causes obesity in cats? It's usually a combination of factors, including overfeeding, lack of exercise, genetics, and even certain medical conditions. Indoor cats are more prone to obesity because they're less active. Genetics can also play a role. The good news is that obesity is preventable and reversible. With a little effort and some lifestyle changes, you can help your cat achieve and maintain a healthy weight. Talk to your vet. They can assess your cat's current weight and body condition, determine their ideal weight range, and help you create a personalized weight loss plan. When it comes to diet, choose a high-quality, balanced food that's appropriate for your cat's age, breed, and activity level. Exercise is also crucial. Even indoor cats need regular physical activity to stay healthy and fit. Try to engage your cat in play for at least 15 minutes twice a day. The key is to get them moving. Remember, helping your cat lose weight is an act of love. It's about giving them the best possible chance at a long, healthy, and happy life. Chapter 9. Kidney disease is a serious condition that affects the kidneys, those amazing little bean-shaped organs responsible for filtering waste products from the blood, regulating blood pressure, and producing important hormones. Kidney disease is more common in older cats, but it can affect cats of any age. The tricky thing about kidney disease is that it often doesn't show any symptoms in its early stages. Increased thirst and urination are often the first clues. Other signs include weight loss, loss of appetite, vomiting, lethargy, bad breath, and changes in urination. If you notice any of these symptoms, it's important to take your cat to the vet right away. Unfortunately, there's no cure for kidney disease. But with early diagnosis and treatment, you can slow the progression of the disease and help your cat live a longer, more comfortable life. Living with a cat with kidney disease can be challenging, but it's not impossible. And there you have it, folks. 9 common cat illnesses and issues that every cat owner should be aware of. We covered a lot of ground today, from the weird and wacky to the downright serious. But the most important thing to remember is that knowledge is power. By learning about these common health concerns, you'll be better equipped to spot the signs early on and get your cat the help they need. Remember, cats are masters at hiding pain, so it's up to us to be vigilant and advocate for their well-being. Keep an eye on your furry friends, trust your instincts, and don't hesitate to contact your vet if you notice anything unusual. Early detection and intervention can make all the difference. Thanks for watching, and don't forget to subscribe for more pet tips and tricks.